Okay, in the last class we had discussed the Rasa Vimana. So, looking further, Trivida Kukshiya Vimana. So this chapter is very important because this is having some similar information from Ashtangradi also. Ashtangradi also has the similar information, but the understanding is different there. Okay, so that's why the questions would be framed around these things. Okay, and also the Vikrutis. Okay, Vikrutis which are produced because of the ಅಗ್ನಿ ಓಕೆ ಅಗ್ನಿ ವೈಷಮ್ಯದಿಂದ ಆಗುವಂಥದ್ದು ಅಥವಾ ಅತಿಮಾತ್ರ ಅಶನ. ಓಕೆ, ಸೊ ಇದೆಲ್ಲ ಕಾನ್ಸೆಪ್ಟ್ಸಿಂದ ನಿಮಗೆ ಎಕ್ಸಾಮಲ್ಲಿ ಕ್ವಶನ್ಸ್ ಕೇಳ್ತಾರೆ. ಸೊ ಆ್ಯಂಡ್ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ಈಸ್ ಅಬೌಟ್ ದ ಅಗ್ರೆ ಸಂಗ್ರಹ ಅಂದರೆ ಅತಿಮಾತ್ರ ಅಶನ, ಅನಶನ. ಓಕೆ, ಅನಶನ ಮಹೇಶ್ವರ ರಾಸಕಾರಣಂ. ಓಕೆ, ಅಜೀರ್ಣ ಅಧ್ಯಾಶನ, ವಿರುದ್ಧ ವೀರ್ಯಾಶನ, ನಿಂದಿತ ವ್ಯಾಧಿಕರಣಂ. ಸೊ ಇದೆಲ್ಲ ತುಂಬ ಬಾರಿ ಎಕ್ಸಾಮಿಗೆ ಕೇಳಿದ್ದಾರೆ. ಸೊ ಯು ಹ್ಯಾವ್ ಟು ರಿಲೇಟ್ ದೀಸ್ ಥಿಂಗ್ಸ್ ವಿತ್ ದೇರ್ ಆಲ್ಸೋ ಅಗ್ರೆ ಸಂಗ್ರಹ. ಓಕೆ, ಸೊ ತ್ರಿವಿಧ ಕುಕ್ಷಿಯದಲ್ಲಿ ಆಮ ಪ್ರದೋಷದ ವಿಕಾರ. ಓಕೆ, ಸೊ ಅದು ಅಲಸಕ ವಿಸೂಚಿಕ ಆ್ಯಂಡ್ ಆಲ್ಸೋ ದ ಎಕ್ಸ್ಟೆಂಡೆಡ್ ಫಾರ್ಮ್ಸ್ ಆಫ್ ಅದರ್ ಲೈಕ್ ವಿಲಂಬಿಕ. ಓಕೆ, ಸೊ ಎಸ್ಪೆಷಲಿ ಫ್ರಮ್ ದ ಅಷ್ಟಾಂಗ, ಹೃದಯ ಆ್ಯಂಡ್ ದ ಸುಶ್ರುತ. ಸೊ ದೋಸ್ ಥಿಂಗ್ಸ್ ಯು ಶುಡ್ ನೋ. ಓಕೆ, and here they are going to quote here like very basic things, you know these things. Ekam avakasham amsham ಮೂರ್ತಾನಂ ಆಹಾರ ವಿಕಾರಣಂ, ಏಕಂ ದ್ರವಾಣಂ, ಏಕಂ ಪುನಃ ವಾತಪಿತ್ತಶ್ಲೇಷ್ಮಣಂ. ಸೊ ದಿಸ್ ಅಂಡರ್ಸ್ಟ್ಯಾಂಡಿಂಗ್ ಯು ನೋ, ಬಟ್ ವಿ ಹ್ಯಾವ್ ಅ ಡಿಫರೆಂಟ್ ಅಂಡರ್ಸ್ಟ್ಯಾಂಡಿಂಗ್ ಫ್ರಮ್ ಅಷ್ಟಾಂಗ ಹೃದಯ. ಓಕೆ, and also very fascinatingly like this can be also related with the Japanese technique. Okay, so even the Japanese also have this same technique of food diet. Okay, so they are very well aware of these things, like we have to have some space left for the doshas, right? But we Indians, we don't do in such way. Okay, we fill up to our throat. Okay, and this shloka number 4 is very important. Okay, practically this very important because they are explaining here न च केवलं मात्रावत् एव आहारस्य कृत्स्नम् आहारफलसौष्ठम् अवाप्तुं शक्यं. That means matra is not only one factor which is going to influence the proper digestion of the food. ಅಂದರೆ ಡೈಜೆಷನ್ ಆಫ್ ದ ಫುಡ್ ಮತ್ತು ಅದರದ್ದೇನು ಗುಣಗಳು ಬೇಕು ಅಂದರೆ ಮಾತ್ರವತ್ ಆಹಾರ ಒಂದೇ ಫ್ಯಾಕ್ಟರ್ ಅಲ್ಲ, ಮತ್ತು ಬೇರೆ ಬೇರೆ ಎಲ್ಲ ಫ್ಯಾಕ್ಟರ್ನೂ ಸಹ ಇಂಪಾರ್ಟೆಂಟ್ ಅಂತ ಹೇಳ್ತಾರೆ. ಅದಕ್ಕೆ ನೆಕ್ಸ್ಟ್ ಲೈನಲ್ಲಿ ಹೇಳ್ತಾರೆ, ಪ್ರಕೃತ್ಯಾದೀನಾಂ ಅಷ್ಟಾನಾಂ ಆಹಾರ ವಿಧಿ ವಿಶೇಷಾಯತನಾಂ ಪ್ರವಿಭಕ್ತ ಫಲತ್ವಾತ್. ಓಕೆ, ಸೊ ಮಾರ್ಕ್ ದಿಸ್ ಟರ್ಮ್ ಪ್ರವಿಭಕ್ತ ಫಲತ್ವಾತ್, ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ಬಿಕಾಸ್ ಈಚ್ ಒನ್ ಆಫ್ ದೀಸ್ ಫ್ಯಾಕ್ಟರ್ಸ್, ಪ್ರಕೃತಿ, ಓಕೆ, ಸಂಯೋಗ, ಓಕೆ, ಸಂಸ್ಕಾರ, ಸೊ ಆಲ್ ದಿಸ್ ವಾಟ್ ಎವರ್ ದ ಅಷ್ಟವಿಧ ವಿಶೇಷಾಯತನ they have mentioned, they are equally important. Pravibhakta phala, that means each one is having their own effects. So that's why they're explaining here matra is one among the factor among them, but all the factors are also very important. Okay, so this is the conceptual understanding explained here. Okay, conceptually you should know some of the things. Okay, next is about the matravat ahara lakshana. So these things you can work out. Okay, so conceptually ಕುಕ್ಷೇರ ಪ್ರಪೀಡನಂ ಆಹಾರೇಣಂ ಹೃದಯಸ್ಯ ಅನವರೋಧಃ. ಓಕೆ, ಪಾರ್ಶ್ವಯೋಃ ವಿಪಾಟನಂ ಅನತಿಗೌರತ್ವಂ ಉದರಸ್ಯ. ಓಕೆ, ಸೊ these are some things which can be asked. Okay, they can ask like in the exception based questions, which among the following is not explained as a matravat lakshana, or like which among the following is mark the answer, or like they can jumble. Okay, two options, three options together. Okay, so also they, like this also they can do. Okay, ಸಾಯಂ ಪ್ರಾತಶ್ಚ ಸುಖೇನ ಪರಿಣಮನಂ. ಓಕೆ, ಪ್ರಾಪರ್ ಡೈಜೆಷನ್. ಓಕೆ, ಸ್ಥಾನ ಆಸನ ಶಯನ ಗಮನ ಉಚ್ಛ್ವಾಸ ಪ್ರಶ್ವಾಸ ಹಾಸ್ಯ ಸಂಕತಾಸು ಸುಖಾನುವೃತ್ತಿ. ಸೊ this is very practical. Sometimes when you have like a little bit more food, then you feel uneasiness. Okay, so that uneasiness, so here they are explaining this sukhanurutti. You will be able to do all the activities very properly. Okay, sukhanurutti prinanam indriyanam ಕ್ಷುತ್ ಪಿಪಾಸ ಉಪರಮಹಂ ಅನತಿಗೌರಂ ಉದರಸ್ಯ. ಸೊ ನಾಟ್ ಫೀಲಿಂಗ್ ಟೂ ಹೆವಿ ಆನ್ ದ ಸ್ಟಮಕ್, ಅಂದರೆ ಹೊಟ್ಟೆ ಉಬ್ರ ಅಥವಾ ಹೊಟ್ಟೆ ಭಾರ, ಸೊ ಆ ಥರ ಏನೂ ಆಗಬಾರ್ದು ಅಂತ. ಓಕೆ, ಸೊ ಅಮಾತ್ರಾವತ್ವಂ ಪುನರ್ದ್ವಿವಿಧಂ. ಓಕೆ, ಸೊ ಅಮಾತ್ರ ಆಹಾರ. ಓಕೆ, ಹೀನ ಆ್ಯಂಡ್ ಅಧಿಕ. ಸೊ ದ ನೆಕ್ಸ್ಟ್ ದೇ ಆರ್ ಗೋಯಿಂಗ್ ಟು ಎಕ್ಸ್ಪ್ಲೇನ್ ಅಬೌಟ್ ದಿಸ್ ಅತಿಮಾತ್ರ ಆ್ಯಂಡ್ ಹೀನ ಮಾತ್ರ, ವಾಟ್ ಈಸ್ ದ ಎಫೆಕ್ಟ್ ದಟ್ ಈಸ್ ಎಕ್ಸ್ಪ್ಲೇನ್ಡ್ ಹಿಯರ್. ಓಕೆ, ಅತಿಮಾತ್ರಂ ಪುನಃ ಸರ್ವದೋಷ ಪ್ರಕೋಪಣಂ ಇಚ್ಛಂತಿ. ಸೊ ಅತಿಮಾತ್ರ ಲೀಡ್ಸ್ ಟು ಸರ್ವದೋಷ ಪ್ರಕೋಪ. ಓಕೆ, ಮಾರ್ಕ್ ದಿಸ್ ಆಸ್ ಇಂಪಾರ್ಟೆಂಟ್. ಅಧಿಕಂ ಚ. ಓಕೆ, ಸೊ ನೆಕ್ಸ್ಟ್ ದೇ ಆರ್ ಗೋಯಿಂಗ್ ಟು ಕೋಟ್ ಆಲ್ಸೋ ದ ಅಮಾತ್ರ ಆ್ಯಂಡ್ ಅಧಿಕ ಮಾತ್ರ, ಅತಿಮಾತ್ರ. ಓಕೆ, ಯೋ ಹಿ ಮೂರ್ತಾನಾಂ ಆಹಾರ ಜಾತಾನಾಂ ಸೌಹಿತ್ಯಂ ಗತ್ವ ದ್ರವೈಹಿ ತೃಪ್ತಿಮಾಪದ್ಯತೆ. ಸೊ ದೇ ಆರ್ ಗೋಯಿಂಗ್ ಟು ಡಿಫೈನ್ ವಾಟ್ ಈಸ್ ಎಕ್ಸಾಕ್ಟ್ಲಿ ದಿಸ್ ಅತಿಮಾತ್ರ. ಸೊ ಹೌ ಯು ಕ್ಯಾನ್ ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್ ಅತಿಮಾತ್ರ. ಸೊ ದೇ ಆರ್ ಎಕ್ಸ್ಪ್ಲೇನಿಂಗ್ ಹಿಯರ್ ಯೋ ಹಿ ಮೂರ್ತಾನಾಂ ಆಹಾರ ಜಾತಾನಾಂ. ಸೊ ಫಸ್ಟ್ ಯು ಆರ್ ಗೋಯಿಂಗ್ ಟು ಹ್ಯಾವ್ ದ food substances, whatever you have the food substances, sauhityam gatva, that means you eat to the full extent. Okay, you eat till the satiety, that means you get trupti, sauhityam gatva. Then after that again you have you fill the stomach with the dravaihi trupti mapadete. So already you are stomach full, then again you are going to fill that, to that you will add the Dravaihi Truptima Padete. So this is explained as a Atimatra. So Atimatra should be understood in this way. So this is very important because this understanding of Sauhitya. So Sauhitya is very important clinically. Where have you heard this word Sauhitya in which diseases? Sahate nati Sauhityam, Sahate nati Sauhityam, Sauhityam nati Sahate. So have you heard this one, Udara and the Gulma? Is it there? Such similar explanation is there in Udara and Gulma? Yes or no? You can type in the chat box, yes or no. Sahate nati Sauhityam, Sauhityam na Sahate. So we have this understanding in Gulma and Udara. Okay, so you can just cross refer from there. Okay. Sarve Yugapat Prakopam Apadante. So this term is very, Yugapat is very important because Yugapat is simultaneous. It's not like first Vata, first Pitta, first Kapha. It's not like that. Sarve Yugapat. So simultaneously all the dosha Prakopa will happen. Okay, so this is also important. Okay. And Vishtambhayantaha. So it is going to cause Vishtambhata. Sahasa Vapi Uttaradharabhyam Margabhyam Prachavayanta. So it is going to cause the movement of the doshas. Okay, Udara like upward route and downward route. So you have this understanding of this Lasaka and Visuchika. So there is nothing much I can explain on this Visuchika Lasaka. You have already worked out on all these things. Okay. So then again also they are going to give the significance of the Manasika Bhavas. Okay. Na cha khalu kevalam matra meva ahara rashim ama pradoshakaram ichanti. So only, not only just the ahara rashi is not only the factor which is going to influence the ama pradosha, and they are also explaining here some of the other factors like matraya api abhyavahritam pathyam cha annam na jirati. Okay, so if even the person is having the food in the matra, okay, the person is having the food in the proper matra only, even with that thing, there might be a possibility of the ajirana cause. Okay, patyam cha annam na jiryati. So next they are explaining because of this chinta shoka bhaya krodha dukha shaya prajagara. So these things they can make this for the assertion and reasoning. Okay, so assertion would be the annam na jiryati. Okay, matraya api abhyavrutam annam na jiryati, and reasoning would be because of chinta shoka bhaya krodha. So these are the very basic principles. Okay, very basic principles explained in the Vimanasana. So such things they can ask in the exams. Okay, they will frame such things in the exams. Okay, so you can mark this as very important. This is very conceptually important, and also clinically you have to elicit these things. Okay, clinically also you have to elicit these things. Okay, next is about the amma pradosha. So atimatra, amatra. Next they are going to explain about this amma pradosha, how the amma pradosha can happen. So these things you can work out like lakshanas of the alasaka. So what very important. Okay, so these things Visha Sadrusha Lingatvat. Okay, so Visha Sadrusha Lingatvat. So they are explaining here Alasaka as a Visha Sadrusha Lingatvat, and Chardati Sara Varjanam Ama Pradosha Lingani. So Chardi and Atisara Varjani. So exception. Okay, so such exception based questions they can ask. Okay, so Alasaka is presented with all the Lakshanas of the Visuchika. Only exception is that it is not presented with the Chardi and Atisara. So they are explaining here Tataha Chardi Atisara Varjani Ama Pradosha Lingani. Okay, Abhidharshayanti Atimatrani. Okay, so mark this as important. Okay, exception based questions. Okay, so all the symptoms of amadosha will be presented except the chardi and atisara. Okay, so then next the understanding of this dandalasaka also been explained. Okay, so is dandaka and dandalasaka same? Dandaka and dandalasaka same or different? Are they same? Yes or no? Dandaka and dandalasaka, we have something called dandaka also, dandaka vyadhi, and here we also have the danda alasaka vyadhi. So are they same and different? Okay, so you can just cross refer this one. Okay, dandaka and danda alasaka. Okay, and they're going to give the understanding of the chikitsa also. So how the chikitsa should be done, tatra sadhya mamam. Okay, so if the disease is sadhya, then you have to then go for the assessment of the ama. Okay, sadhya vyadhi, then do the ama assessment, and then you, if the ama is present, do pradushtam alasi bhutam ullekhay dadav. So pradushtam alasi bhutam, so alasaka alasi bhuta tishtanti, so which is in the alasi bhuta avastha, then you do the ullekhana chikitsa, vamana chikitsa. Okay, payatva. So how it should be done? So all these things what they will do, they can frame this for statement based questions. Okay, so which among the following is true related with the alasaka? Okay, so initially what they will do, they will give two statements about the lakshanas of the alasaka. Okay, and that exception of the alasaka, and third one they will give about this chikitsa. Okay, so ulekhana should be done using the salavana ushnavari. Okay, they have not given here any medicine. Okay, they are not given here any medicine, they are not given any ushna vacha, no, any madana phala, any estimado, nothing. Okay, only just lavana jala, it should be added with the it should be in a Ushna. Okay, so Ushna, Sa Lavanam, Ushnam Vari. Okay, so such thing they will ask in the exam. So when they make the statement based questions, you should be very careful. Okay, especially conceptual based questions from the Charaka Samhita. When they're making the statement based questions, you should be very careful. ತುಂಬ ಪ್ರಿಸೈಸ್ ಆಗಿ ಅಷ್ಟು ನೀಟಾಗಿ ವರ್ಕೌಟ್ ಮಾಡಿದರೆ ಅದನ್ನ ಅಟೆಂಡ್ ಮಾಡಬೇಕು. ಓಕೆ, ಸೊ ಆರ್ ಎಲ್ಸ್ ಯು ಕ್ಯಾನ್ ಮೇಕ್ ಸಮ್ ಗೆಸ್ ವರ್ಕ್ಸ್ ಇಫ್ ಇಟ್ಸ್ ಫ್ರಮ್ ದ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ವೆರಿ ವೆಲ್ ನೋನ್ ಕಾನ್ಸೆಪ್ಟ್. ಅಂದರೆ ತುಂಬ ವೆಲ್ ನೋನ್ ಕಾನ್ಸೆಪ್ಟಿಂದ ಇತ್ತು ಅಂತಂದರೆ ಅವಾಗ ನೀವೊಂದು ಗೆಸ್ ವರ್ಕ್ ಮಾಡ್ಬೋದು ಅಷ್ಟೇ. ನೀವು ಅದ್ರ ಬಗ್ಗೆ ಓದಿರಲಿಲ್ಲ ಅಂತಂದರೆ ಸುಮ್ಮನೆ ರಿಸ್ಕ್ ತೊಗೊಳ್ಳೋದು ಬೇಡ. ಡೋಂಟ್ ಟೇಕ್ ಮಚ್ ರಿಸ್ಕ್ ಇಫ್ ಯು ಆರ್ ನಾಟ್ ವೆರಿ ಪ್ರೆಟಿ ಪರ್ಫೆಕ್ಟ್ ವಿತ್ ದ ಪರ್ಟಿಕ್ಯುಲರ್ ಥಿಂಗ್ಸ್. ಓಕೆ, ಸೊ ದಿಸ್ ಈಸ್ ವೈ ಬಿಕಾಸ್ ಎಕ್ಸಾಮಿನರ್ ವಿಲ್ ಬಿ ವೆರಿ ಟ್ರಿಕ್ಕಿ ವಿತ್ ದೀಸ್ ಥಿಂಗ್ಸ್. ಅಂದರೆ ಕಾಮನಾಗಿ ಸ್ಟೂಡೆಂಟ್ಸ್ ಏನು ಥಿಂಕ್ ಮಾಡ್ತಾರೆ, ಓಕೆ ಈ ಥರ ಕೇಳಿದ್ದಾರೆ ಅಂದರೆ ಮೇ ಬಿ ಇದು ಇರ್ಬೋದು, ಹೀಗಿರಬಹುದಾ, ಅವ್ರದ್ದು ಯು ಜಿ ಲರ್ನಿಂಗಲ್ಲಿ ಏನು ಓದಿರ್ತಾರೆ. ಓಕೆ, ಸೊ ವಾಟ್ ಎವರ್ ದೇರ್ ಲರ್ನಿಂಗ್ ಆರ್ ಅಂಡರ್ಸ್ಟ್ಯಾಂಡಿಂಗ್ ಈಸ್ ಫ್ರಮ್ ದ ಯು ಜಿ ಲರ್ನಿಂಗ್, ದೇ ಟ್ರೈ ಟು ನೇವಿಗೇಟ್ ದ ಆನ್ಸರ್ ವಿತ್ ದಟ್ ಇನ್ಫಾರ್ಮೇಷನ್. ಓಕೆ, ಸೊ ದಿಸ್ ಯೂಶಲಿ ಸ್ಟೂಡೆಂಟ್ಸ್ ಆರ್ ಗೋಯಿಂಗ್ ಟು ಮೇಕ್ ಮಿಸ್ಟೇಕ್ಸ್ ಇನ್ ಸಚ್ ಥಿಂಗ್ಸ್. ಓಕೆ, ಸೊ ದ್ಯಾಟ್ಸ್ ವೈ you are not expected to do so. Okay, tatah swedana. Okay, then here it is very clear tatah, that means here they are mentioning about the order. Okay, so first it should be vamana only, then swedana only, then varti pranidhana. Okay, so they will ask in this for the order also. Okay, so vidhana tantra yukti. Okay, vidhana based questions. Okay, these things can be framed for vidhana based questions also. Okay, first ullekana, then swedana, then varti pranidhana, and at the end they are explaining here upavasa echa enam. Okay, so this is order very important. They can ask this for the exams. Okay, so this vidhana based, okay, with vidhana based questions they can ask for a exam. Okay, visuchikayam to langhana mevagre. So in visuchika what you do langhana mevagre. So wherever you get this term eva, so this is mentioning about the definiteness. So you have to do like this only. Okay, langhanam eva agre. So you do this one only priorly. First you should do this one only. Okay, langhanam eva agre. So such wherever you get this term eva, okay, langhanam eva agre. So initially this must be done. Okay, viriktavacha anupurvi. So after that you do the chikitsa as the viriktavat chikitsa. Okay, so this is some of the important things explained here. Okay, so next vimukta amadosha ಪುನಃ ಪರಿಪಕ್ವ ದೋಷಸ್ಯ ದೀಪ್ತೆ ಚಾಗ್ನೌ ಅಭ್ಯಂಗ ಅಸ್ಥಾಪನ ಅನುವಾಸನ ವಿಧಿವತ್ ಸ್ನೇಹಪಾನ. Okay, so when they're going to give you the understanding of amapradosha, what you think your usual understanding is like only it should be like langhana deepana pachana, something like that only. But here they're going to explain here paripakvasya doshasya. So if there is a pakvata of the dosha and there is agni deepti, then after then you have to do these chikitsas. Abhyanga should be done, astapana should be done, anuvasana should be done, and vidhiva snehapanam cha yuktya. So you do snehapana chikitsa. So this is very crucial. This is very ಫ್ಯಾಸಿನೇಟಿಂಗ್. ಸೊ ದಿಸ್ ಇಸ್ ನಾಟ್ ಅಕಾರ್ಡಿಂಗ್ ಟು ಯುವರ್ ಯು ಜಿ ಲರ್ನಿಂಗಲ್ಲಿ ಏನು ಓದಿರ್ತೀರಾ. ಸೊ ಆಮ ಪ್ರದೋಷ ಅಂತಂದರೆ ಸೊ ಆಮ ಪಾಚನ ದೀಪನ, ಸೊ ಲಂಘನ ಉಪವಾಸ, ಸೊ ಅದು ಮಾತ್ರ ಅಂತ ತಲೆ ಇಟ್ಕೊಂಡಿರ್ತೀರ. ಬಟ್ ಇಲ್ಲಿ ಏನು ಹೇಳಿದ್ದಾರೆ, ಸೊ ವಾಟ್ ಈಸ್ ದಿಸ್ ಆ್ಯಕ್ಚುಲಿ ಕ್ಲಾಸಿಕಲಿ ಎಕ್ಸ್ಪ್ಲೇನಿಂಗ್ ಹಿಯರ್. ಓಕೆ, so this is how. Okay, amavastha, then you should do this abho chikitsa, and if it's in pakva avastha, so paripakva doshasya, then you have to do abhyanga asthapana anuvasana vidhivat snehapanam. So this information is very fascinating. Okay, so such things they will ask in the exams. Okay, next is about the understanding about the amasya. They are explaining something amasya, the positioning of the amasya, so location of the amasya, nabhisthanantaram. So you know this all these things. Okay, pakvah sarvashayam. Okay, paschadhamani bhi prapadete. So you know this there is nothing very much specific in this one. You can work out on this one also. Okay, next we have the Janapada Dvamsa Vimana. So very less Janapada Dvamsa Vimana questions are framed, and because this is not carrying that much clinical significance. Okay, so and we'll move on to the next some of the important things here. So important thing is like the order of the dushchikisata. Okay, so among the four factors, the descriptions regarding the four factors is explained, and also regarding the desha, especially regarding the desha, the understanding is explained here. Okay, vaigunyam uppannanam desha kala anila ambhasam. Okay, gariyastvam visheshana hetuma sampravakshate. So this gariyastvam. Okay, so gariyastvam, so this order is important, that is asked in the exams. Okay, exams ಅಲ್ಲಿ ಇದನ್ನು ಕೇಳಿದ್ದಾರೆ ತುಂಬ ಬಾರಿ. Okay, so desha kala anila ambhasa. Okay, desha kala anila ambhasa, ವಾತಾತ್ ಜಲಂ ಜಲಾತ್ ದೇಶಂ ದೇಶಾತ್ ಕಲಂ ಸ್ವಭಾವತಃ. ಸೊ ದಿಸ್ ಈಸ್ ಎಕ್ಸ್ಪ್ಲೇನ್ ಫಾರ್ ದ ಸ್ವಭಾವತಃ ವಿದ್ಯಾತ್ ದುಷ್ಪರಿಹಾರ್ಯತ್ವಾತ್. ಓಕೆ, ವಿದ್ಯಾತ್ ದುಷ್ಪರಿಹಾರ್ಯತ್ವಾತ್ ಗರೀಯಸ್ತ್ವಂ ಅರ್ಥವಿತ್. ಓಕೆ, ಸೊ ದಿಸ್ ಅಂಡರ್ಸ್ಟ್ಯಾಂಡಿಂಗ್ ಇಸ್ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ಸೊ ಆಸ್ ಇನ್ ದ ಎಕ್ಸಾಮ್ ಐ ಥಿಂಕ್ ಯು ಮೈಟ್ ಹ್ಯಾವ್ ವರ್ಕ್ಡ್ ಆನ್ ಆಲ್ ದೀಸ್ ಥಿಂಗ್ಸ್ ವೆರಿ ಪ್ರಿವಿಯಸ್ಲಿ, ವೆರಿ ಬೇಸಿಕ್ ಥಿಂಗ್ಸ್. ಆ್ಯಂಡ್ ದೆನ್ ಈಸ್ ಅಬೌಟ್ ದ ಚಿಕಿತ್ಸಾ. ಸೊ ದಿಸ್ ಚಿಕಿತ್ಸಾ ಇಸ್ ಆಲ್ಸೋ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ಕರ್ಮ ಪಂಚವಿಧಂ ತೇಷಂ ಭೇಷಜಂ ಪರಮುಚ್ಯತೆ. ಸೊ ದಿಸ್ ಕ್ಯಾನ್ ಬಿ ಫ್ರೇಮ್ಡ್ ಫಾರ್ ಹೈಯರ್ ಆರ್ಡರ್ ಕ್ವಶನ್ಸ್ ಲೈಕ್ they will pick this shloka. Okay, karma panchavidam tesham bheshajam paramuchate. So rasayanam vidhivacha upayoga prashasate. So this thing can be framed for the reference based questions. This can be framed, or also they can frame like this shloka is explained in which context, or like which chikitsa. Okay, so this is a very important understanding. Okay, so you get some similar shlokas in some different contexts also. So he should be very clear here. Karma panchavidham tesham beshajam paramuchate. So this is very important. Okay. Next is शस्यते देहवृत्तिश्च भेषजैः पूर्वमुद्रितैः. So satyam bhute dayadanam. So like दैव व्यपाश्रय चिकित्सा सदृत्तस्य अनुवृत्तिश्च प्रशमो गुप्तिरात्मनः. So you have to protect yourself. Okay, प्रशमो गुप्तिः. Okay, आत्मनः. So हितं जनपदानां च शिवानाम् उपसेवनं. So you consume the things which are explained as superior. सेवनं ब्रह्मचर्यस्य तथैव ब्रह्मचारिणाम्. Okay, धार्मिकैः सात्विकैः नित्यं साहास्य वृद्धसम्मतैः. So you should be in the company. So how your company should be there. संकथा धर्मशास्त्राणां. You do the listen to the dharmashastras maharshinam jitatmanam. Okay, you should be in the association of these persons. Okay, and next is very important. So you have to differentiate this one. Prajnaparada is explained as yoni, and adharma is explained as mula. Okay, purvakrita karma and adharma is explained as mula. So vaivadinam yad vaikunyam utpadyate tasya moolam adharmaha. Okay, tasya moolam adharmaha. So this is very particularly explained. Tasya moolam adharmaha. Tan moolam va asat karma purvakritam. Okay, so yoni and mula. So they'll frame very particularly on these technical terms. Okay, you should be clear with these technical terms. Tasya moolam adharmaha. Tasya तन्मूलं पूर्वकृतं कर्म. ओके, तयो योनिः प्रज्ञापराध एव. ओके, योनिः प्रज्ञापराध एव. So such precisely they are going to explain these terms. Okay, yoni is prajnaparadha, mula adharma. Okay, so mula adharma tan va asat karma purvakrita karma. So this is also very important. Okay, and next is about the given some understanding about the wars, and also what was the purposes wars used to be conducted in the previous days. So those things, and Yuganurupa. So this is also very important, like based on the some mythology they have given here. Okay, so yuge dharma padaha kramena anena hiyate. So this is also a very important reference. So yuge dharma padaha kramena anena hiyate. So this is also a very important reference. Okay, samvatsara shite purna yati samvatsarakshyam. So this shloka is important. I think you know this concept also. And this shloka is also important. Daiva matmakrutam vidyat karmayat paurodehikam. So regarding the purvakrita karma and daiva and purushakara. So this understanding of this daiva and purushakara, so this is also very important, which is also explained in Charaka Sharira first chapter. We also get this understanding of daiva and purushakara from the Charaka Sharira first chapter. Here also they are explaining. So what is exactly daiva? Okay, what is exactly daiva? What is exactly purushakara? So that understanding is given here. Okay, daive purushakare cha sthitam hi asya balablam. So this term, okay, daive purushakare cha sthitam hi asya balablam. Daivam atmakrutam vidyat. That means daiva is atmakruta at parodehikam. So this understanding is important. I think you know this all these understandings. Okay, and again this reference is also very important. Don't confuse this with the Charaka Sharira first. Okay, so this in reference daivam purushakarena durbalam hi upahanyate. So whichever is dominating over the other, it is going to subdue. Okay, so daivena cha itaret karma vishishtena upahanyate. Okay, daivam purushakarena durbalam upahanyate. So this thing can be asked for a reference based question. And also regarding the niyata ayu and aniyata ayu. Okay, so niyata ayu and aniyata ayu, so that they are going to explain here. Okay, so this is also a very important understanding explained here in this chapter. That means if the person is going to survive or not during the janapada, what are the factors that will influence the ayu of the person? Okay, many people die, many people survive during the janapada. Many people die and many people survive. So what is exactly the factor that will influence the death? What is the factor that will influence the ayu, niyatayu and aniyatayu? Okay, so this is also a very important understanding explained here, and they are going to explain a very important simile here. Okay, very important simile regarding the ratha. Okay, so if there is a ratha, if the ratha is not taken care of properly, then it is going to destroy very easily. Okay, so even though it is running in a very good road, then it may get destroyed early, because it is not taken well care of. Okay, if it is not taken well care of, then it will get destroyed, or the wear and tear will happen very easily. So this is understanding explained here in this understanding of niyata ayo. Okay, mrityu kala mrityu. So this is the understanding explained here. Okay, so you can work out on this one also. So eva akshe sati bhara adhishtitatvat. Okay, so next they are going to explain here that the same thing. Okay, the vehicle is proper, vehicle is good, but you are not taking care of the vehicle, then it is going to destroy very easily. Okay, and then next is about the Ushna Jala Prayoga. So these things can ask you in the exams. Okay, again from the Charaka Nidana first chapter also we have this understanding of Ushna Jala Prayoga. So that is also important. Sarpi Prayoga and Ushna Jala Prayoga, which is explained there in the chapter. Okay, so the Charaka Nidana first chapter, and also again the Ushna Jala Prayoga explained here in this chapter. So this very important information. Very important information. This is the way the Samhita has been explained. In Samhitas, this is like a method of presentation, how the things are being knit, or how the things are being presented in the samhitas. This is the way how they're presenting. So we get the contextual explanations. That means ushna jala is very important, especially in the periods of janapada. So that's why they're going to explain everything in detail about this ushna jala here. Okay, they're explaining here. ज्वरो हि आमाशय समुत्थः प्रायो समुत्थः प्रायो भेषजानि च आमाशय समुत्थानं विकारणं पाचन वमन पतर्पणसमर्थानि भवन्ति. पाचनार्थं हि पानीयम् उष्णं. So these things can be framed for statement based questions and also can be made as assertion and reasoning. Okay, so assertion is use of ushna jala, and reasoning is like what is its action actually. Okay, पाचनार्थं च पानीयम् उष्णं तस्मात् एतत् ज्वरितेभ्यः प्रयच्छन्ति पिशिजो भूयिष्ठम्. Okay, so आमाशय समुत्थः. So because jara is आमाशय समुत्थः, then they are going to explain here. Okay, तद्धि तेषां पीतं वातमनुलोमयति अग्निं च उदीर्यम् उदीरयति क्षिप्रं जरा गच्छति. Okay, so this is the reasoning. So what is the reasoning here? Okay, उष्णेन हि दाह भ्रम प्रलाप अतिसारा भूयो अभिवर्धन्ते. So if you're using more ushna, so they are going to explain here. Okay, bhuyo abhivardante shitena cha upashamyanti iti. So this understanding you can make this. Okay, and next is about this 41st shloka. Shitena ushna kutan rogam shamayanti bishagvidah etu shitakrutah roga tesham ushnam bishagvitam. So this is also a very important reference which is explaining about the samanya vishesha siddhanta. So in sutrasana we get this samanya vishesha siddhanta in the first chapter itself. Okay, dirghan jivite adhyaya, but the application of this samanya vishesha siddhanta is seen throughout the samhitas. Okay, is seen throughout the samhitas. ಬೇರೆ ಬೇರೆ ಎಲ್ಲ ಕಂಟೆಕ್ಸಲ್ಲಿ ಹೋಗ್ತೀವಿ, ಎಲ್ಲ ಕಡೆನೂ ನಮಗೆ ಸಾಮಾನ್ಯ ವಿಶೇಷ ಸಿದ್ಧಾಂತದ್ದು ಅಪ್ಲಿಕೇಶನ್ಸ್ ವಿಶೇಷವಾಗಿ ಸಿಗುತ್ತೆ ನಮಗೆ. ಓಕೆ, ಸಾಮಾನ್ಯ ವಿಶೇಷ ಸಿದ್ಧಾಂತದ ಅಪ್ಲಿಕೇಶನ್ಸ್ ನಮಗೆ ತುಂಬ ಕಡೆ ಸಿಗುತ್ತೆ. ಸೊ ಹಾಗಾಗಿ this reference is also important. Mark this as important. Just you can just remember there is something explained as a shitena ushna kurtan rogan shamayanti pishagvida. So you do the opposite chikitsa. Okay, shita vyadhi do the ushna chikitsa, ushna vyadhi do the shita chikitsa. So this is something explained here. Okay, and next is about the apatarpana. So this trivida apatarpana, this also asked in the exam so many times. So mark this as very very important. This understanding of apatarpana chikitsa, trivida apatarpana chikitsa, and the protocols. Like this is like algorithm. So apatarpana, how the apatarpana should be exactly done, and how it should be chosen, and where it should be chosen. Okay, so like regarding the dosha. Okay, so the strength of the doshas and regarding the strength of the patient. Okay, looking into consideration of the vyadhi bala and vyadhita bala, you have to take into consideration of both also. Okay, you have to look into the vyadhi bala and also the vyadhita bala, the strength of the patient. So you have to work out this one. So apatarpanam cha trividham langhanam langhanapacanam doshavasechanam cheti. You can understand very easily doshavasechana. Okay, so because it's very clear, like if the avastha is in bahudosha avastha, then you go for the doshavasechana, and for this they are going to give the simile also. Okay, they are going to give some simile also, and these similes can also be asked in the exams. Okay, nahi abhinne kedara seto. Okay, palvala apraseko ati. Okay, so this simile is also asked in the exams. Exam also similes itara ಕೇಳಿದ್ದಾರೆ ನಿಮಗೆ. And even we have the some similes for the dosha shamana from the roga chatushka. Okay, so from the roga chatushka for the vatasya upakrama, pittasya upakrama, and shleshma upakrama, and we have some similes there, so that they are also important. Okay, so tatra langhanam alpabala doshanam. Okay, alpabala doshanam, you do the langhana chikitsa. Langhanena hi agni maruta rudhyam vatatapa परितं व अल्प उदकम अल्पो दोषः प्रशोषम आपद्यते. So they are going to give some similes here. So how the less water is there in the pond, it is going to be dried by the little quantity of the vata and atapa. So in the same way, if the doshas are very less, okay, doshas are very less, then langhana is sufficient to cause the dosha shamana. Okay, so like this they are also explaining the for the langhana pachana dosha vasachana, langhana pachana also. Okay, surya santapa maruthabhyam pamshu bhasma. Okay, you can anati bahudukam madhyabala doshanam dosha prashoshyam apade. So similarly they are explaining this similarly for all these things. Okay, so this also a very important understanding. Okay, and next is about tadatve cha anubandhe va yasya tad sad ashubham phalam कर्मणः स्तन्न कर्तव्यम. Okay, so this is also like anubandhata. So karma phala anubandhata is explained here. So you can mark this as also reference based question ಅಲ್ಲಿ ಇದು ಸಹ ಪ್ರೀವಿಯಸ್ ಅಲ್ಲಿ ನಿಮಗೆ ಕೇಳಿದ್ದಾರೆ, ತದಾತ್ವೇಚ ಅನುಬಂಧೇವ ಯಸ್ಯ ಸ್ಯಾದ ಅಶುಭಂ ಫಲಂ. ಸೊ ಇದು ಸಹ ಎಕ್ಸಾಮಲ್ಲಿ ಪ್ರೀವಿಯಸ್ ಇಯರ್ ಕ್ವಶನ್ ಪೇಪರ್ಸಲ್ಲಿ ಇದು ಸಹ ಕೇಳಿದ್ದಾರೆ. ಸೊ ಮಾರ್ಕ್ ದಿಸ್ ಇಸ್ ಆಲ್ಸೋ ಇಂಪಾರ್ಟೆಂಟ್. ಆ್ಯಂಡ್ ದೆನ್ ರಿಗಾರ್ಡಿಂಗ್ ದ ದೇಶ ಲಕ್ಷಣಸ್ ಆಲ್ಸೋ, ದೇಶ ಲಕ್ಷಣ ಯು ಕ್ಯಾನ್ ಜಸ್ಟ್ ಮೇಕ್ ಅ ನೋಟ್ ಹಿಯರ್ ಲೈಕ್ ದೇಶ ಲಕ್ಷಣಸ್ ಆರ್ ಎಕ್ಸ್ಪ್ಲೇನ್ಡ್ ಹಿಯರ್ ಇನ್ ದಿಸ್ ಚಾಪ್ಟರ್. ಓಕೆ, ಆ್ಯಂಡ್ ನೆಕ್ಸ್ಟ್ ಇಸ್ ಅಬೌಟ್ ತ್ರಿವಿಧ ರೋಗ ವಿಶೇಷ ವಿಜ್ಞಾನೀಯ ವಿಮಾನ. ಸೊ ದಿಸ್ ಚಾಪ್ಟರ್ ಈಸ್ ವೆರಿ 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 ಇಂಪಾರ್ಟೆಂಟ್ ಬಿಕಾಸ್ ದಿಸ್ ಈಸ್ a very important chapter which is giving the guidelines for the examination. So pramana, okay, pramana. So in darshanas we get the term pramana, but whereas in Charaka Samhita we don't get the term pramana, but instead Charaka Samhita uses the word pariksha. Okay, so the term pariksha has been used by the Charaka Samhita to give the notion of pramana. So to give us the understanding of pramana, Charaka Samhita uses the term pariksha. So this understanding you should know. Okay, so this understanding you should know. So the term pariksha is equivalent to pramana from the Charaka Samhita. Okay, त्रिविधं खलु रोगविशेषविज्ञानं भवति तद्यथा आप्तोपदेशः प्रत्यक्षम् अनुमान. So this shloka is there. And then regarding the the definition of the aptopadesha, so anumana, so all these things are very important. And they can ask this for the reference based, or like they can also ask for the complete the shloka. Okay, fill in the blanks. Anumanam khalu tarko yuktapekshah, anumanam khalu tarko yuktapekshah. Okay, so these definitions we also have from the sutrasan also, the understanding of this apta. Okay, apta definitions and pratyaksha definitions and anumana definitions we have from the sutrasan and also from the Charaka Vimana 8th also. Okay, Charaka Vimana 8th also. So these three references it should be worked out. Okay, so ಈ ಮೂರು ರೆಫರೆನ್ಸಸ್ ನಿಮಗೆ ಇದೇ ಬೇಸಿಸಲ್ಲಿ ಇರುತ್ತೆ, ಅದನ್ನು ಸಹ ನೀವು ವರ್ಕೌಟ್ ಮಾಡಬೇಕು. ಓಕೆ, ಆ್ಯಂಡ್ ದಿಸ್ ಶ್ಲೋಕ ಇಸ್ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ದಿ ವಿಲ್ ಫ್ರೇಮ್ ದಿಸ್ ಫಾರ್ ರೆಫರೆನ್ಸ್ ಬೇಸ್ಡ್ ಕ್ವಶನ್ಸ್. ನ ಹಿ ಜ್ಞಾನ ಅವಯವೇನ ಕೃಷ್ಣ ಜ್ಞೇಯ ಜ್ಞಾನ ಉತ್ಪದಿತೆ. ಸೊ ದಿಸ್ ಈಸ್ ರಿಪೀಟೆಡ್ ಅಗೇನ್ ಇನ್ ದ ನೆಕ್ಸ್ಟ್ ಚಾಪ್ಟರ್ ಆಲ್ಸೋ. ಸೊ ದಿಸ್ ಈಸ್ ರಿಪೀಟೆಡ್ ಇನ್ ಅಗೇನ್ ದ ನೆಕ್ಸ್ಟ್ ಚಾಪ್ಟರ್ ಆಲ್ಸೋ. ಸೊ ದ ಸೇಮ್ ಶ್ಲೋಕ ಇಸ್ ರಿಪೀಟೆಡ್ ಟ್ವೈಸ್. ಸೊ ದಿಸ್ brings the significance of the shloka. So when it is subadham bhavati, so punaruktam cha subadham bhavati. So that means if there is any punarukta, like punarukti is a tantra dosha. Actually in a tantra doshas we have the term punarukta. Okay, punarukta dosha, but in samhitas they are going to quote if it is a repeated again, then you have to consider that as the significance. Okay, punah pranitam, it is if it's explained again and again, then you have to work it as very very important. Okay, so because this shloka is worked out repeated again, so in the next chapter also it is repeated, so that's why this is very important. Okay, the reference can be asked here. Okay, purvam aptopadesha jnanam. Okay, so first you have to get the knowledge from the aptopadesha, tatah, so again order. Okay, tatah pratyaksha anumanabhyam, first aptopadesha and then pratyaksha then anumana. So this is the order. Okay, this is a vidhana. So this is a very basic understanding. Okay, you should know. Okay, aptopadesha, pratyaksha and then anumana. Okay, so then they are going to explain the understanding about the pratyaksha gamya bhavas, anumana gamya bhavas, so aptopadesha gamya bhavas. So all these things they are asked in the exams. Okay, in exams they are asked all these things. Okay, tatra idam upadishanti buddhimantaha. So what here you have to understand this one from the aptopadesha. So aptopadesha, from aptopadesha you have to work out this one. So what you have to work out? Rogam, okay, prakopanam, yonim, okay, utthanam, okay, atmanam, adhishtanam, okay, evam vedanam, evam samsthanam, evam shabdam, sparsham, rupa, rasaganam. So all these things. Udarkam, okay, so tasmin iyam pradikaratam pravruti athava nivrutti. Okay, so this understanding is about the aptopadesha. So these things has to be worked out from the aptopadesha gamya bhava, and again we have the pratyaksha gamya bhava and we have the anumana gamya bhava. So idರಲ್ಲಿ ಏನು ಕಾಂಪ್ರಮೈಸ್ ಇರಲ್ಲ. So there must be these must be worked out very properly, because students will be working out giving so much of attention to this. Okay, especially this ಪ್ರತ್ಯಕ್ಷ ಗಮ್ಯ ಭಾವ ಆ್ಯಂಡ್ ಅನುಮಾನ ಗಮ್ಯ ಭಾವ, ಇದೆಲ್ಲ ಎಕ್ಸಾಮಿಗೆ ತುಂಬ ಬಾರಿ ಕೇಳಿದರೆ 100% ಕ್ವಶನ್ಸ್ ವುಡ್ ಬಿ ದೇರ್ ಫ್ರಮ್ ದಿಸ್ ಒನ್. ಓಕೆ, ಈ ಕಾನ್ಸೆಪ್ಟಿಂದ ನಿಮಗೆ 100% ಕ್ವಶನ್ಸ್ ಇದ್ದೇ ಇರುತ್ತೆ. ಓಕೆ, ಮಾರ್ಕ್ ದಿಸ್ ಆಸ್ ಇಂಪಾರ್ಟೆಂಟ್. 100% ನಿಮಗೆ ಕ್ವಶನ್ಸ್ ಇದ್ದೇ ಇರುತ್ತೆ, ಕ್ವಶನ್ಸ್ ಕೇಳ್ತಾರೆ. ಸೊ ಯು ಹ್ಯಾವ್ ಟು ವರ್ಕೌಟ್ ದಿಸ್ ಒನ್ ವೆರಿ ಪರ್ಟಿಕ್ಯುಲರ್ಲಿ. ಓಕೆ, ಅಗ್ನಿ ಜರಣಶಕ್ತಿಯ ಪರೀಕ್ಷಿತ. ಸೊ ಹೌ ಯು ವಿಲ್ ಡೂ ದ ಪರೀಕ್ಷಾ ಆಫ್ ದ ಅಗ್ನಿ. ಓಕೆ, ಬೈ getting to know about his jarana shakti. What is like he's having 2 chapatis in the morning. Okay, so it is getting digested at the 1 p.m. Okay, so then moderate if it's getting digested at the 11:30 itself. Okay, very good digestive power. Okay, if it's getting digested by 3 p.m. 4 p.m. okay, very less digestive power. So like this the things are explained here. Okay, so all these things are very clinical things. These are very clinical things, and they are explaining here for the assessment or the examination. So many things will be there which will not be explained by the patients. ಅಂದರೆ ಪೇಷಂಟ್ಸ್ ನಿಮಗೆ ಎಲ್ಲ ನಿಮಗೆ ಹೇಳಲ್ಲ. ಸೊ ಮೆನಿ ಥಿಂಗ್ಸ್ ವಿಲ್ ಬಿ ದೇರ್ ವಿಚ್ ಯು ಹ್ಯಾವ್ ಟು ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್ ಆಸ್ ಅ ಫಿಸಿಷಿಯನ್. ಓಕೆ, ವಿಚ್ ಯು ಹ್ಯಾವ್ ಟು ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್ ಆಸ್ ಅ ಫಿಸಿಷಿಯನ್. ಓಕೆ, ಶೋಕಂ ದೈನ್ಯನ. ಓಕೆ, so patients will not come to you and tell you like I am having shoka. So you have to understand the shoka by their dainyata. Okay, dainya chittata, dina chittata. Okay, by their mood itself you have to understand the shoka. So harsham amodena, preetim toshena, bhayam vishadena. So you have to understand the bhaya in the patient. Okay, by observing the vishadata. Okay, so by observing the levels of depression. Okay, the levels of depression or like his depressive thoughts or his depressive mood. Okay, so this is how the everything goes. Okay, virya muthanenam avasthanam avibhramena shraddham ಅಭಿಪ್ರಾಯಣ. ಓಕೆ, ಶ್ರದ್ಧೆ ಇದೆಯೋ ಇಲ್ವೋ ಹೇಗೆ ತಿಳ್ಕೊಳ್ತೀರಾ? ಅಭಿಪ್ರಾಯಣ. ಸೊ ಅವ್ರದ್ದು ಅದರ ಮೇಲೆ ಒಪಿನಿಯನ್ ಏನಿದೆ. ಸೊ ಶ್ರದ್ಧಾಂ ಅಭಿಪ್ರಾಯಣ, ಮೇಧಾಂ ಗ್ರಹಣೇನ, ಸಂಜ್ಞಾ ನಾಮಗ್ರಹಣೇನ, ಸ್ಮೃತಿಂ ಸ್ಮರಣೇನ, ಹ್ರಿಯಂ ಅಪತ್ರಪಣೇನ. ಓಕೆ, ಸೊ ಲಜ್ಜಾ. ಓಕೆ, ಸೊ ದ ಲಜ್ಜಾ. ಸೊ ಹೌ ದ ಶೈ ಇಸ್ ಪರ್ಸನ್ ಇಸ್. ಓಕೆ, ಸೊ ಹ್ರಿಯಂ ಅಪತ್ರಪಣೇನ. ಸೊ ಇದೆಲ್ಲ ತುಂಬ ಬಾರಿ ಎಕ್ಸಾಮಿಗೆ ಕೇಳಿದ್ದಾರೆ, ರಿಪೀಟೆಡ್ ಆಗಿ ಎಕ್ಸಾಮಿಗೆ ಕೇಳಿದ್ದಾರೆ. ಇಫ್ ಯು ಆರ್ ಮೇಕಿಂಗ್ ಎನಿ ಮಿಸ್ಟೇಕ್ಸ್ ಇನ್ ದಿಸ್ ಒನ್ ದೆನ್ ಯು ಆರ್ ಅ ಫೂಲ್. ಓಕೆ, ಸೊ ಮಾರ್ಕ್ ದಿಸ್ ಮೈ ವರ್ಡ್ಸ್. ಇಫ್ ಯು ಆರ್ ಕಮಿಟಿಂಗ್ ಮಿಸ್ಟೇಕ್ಸ್ ಇನ್ ದಿಸ್ ಪರ್ಟಿಕ್ಯುಲರ್ ಕಾಂಟೆಕ್ಸ್ಟ್ ದೆನ್ ಯು ವಿಲ್ ಬಿ ಅ ಫೂಲ್. ಓಕೆ, ಶೀಲಂ ಅನುಶೀಲನೇನ, ದ್ವೇಷಂ ಪ್ರತಿಷೇಧೇನ, ಉಪಾಧಿಂ ಅನುಬಂಧೇನ, ಧೃತಿಂ ಅಲೋಲೇನ, ವಶತಂ ವಿಧೇಯತೆಯ. ಓಕೆ, ಸೊ ವಶತ, ಸೊ ವಿಧೇಯತೆಯ. ಸೊ the person is following the orders of the physician. Okay, vashata, the patient must be vashata to the vaidya. Okay, so he should be vashata. So how can understand this vashata? Vidheyatah, by listening how far the patient is listening to the instructions of the physician. Okay, so physician instructions, how it is followed by the how it is followed. Okay, so this is how the goes. Okay, ayushah kshayamarishta upasthita shreyasvam kalyana abhiniveshena. So amalam satvam avikarena. So ಇದೆಲ್ಲ ಎಕ್ಸಾಮ್ಗೆ ತುಂಬ ಬಾರಿ ರಿಪೀಟೆಡಾಗಿ ಕೇಳಿದ್ದಾರೆ. ಸೊ ಎಕ್ಸಾಮ್ಗೆ 100% ಈ ಕಾಂಟೆಕ್ಸಿಂದ ನಿಮಗೆ ಕ್ವಶನ್ಸ್ 100% ಬಂದೇ ಬರುತ್ತೆ. ಹಾಗಾಗಿ ನೀವು ಇದನ್ನು ಅಷ್ಟು ನೀಟಾಗಿ ವರ್ಕೌಟ್ ಮಾಡಬೇಕು, ಅಷ್ಟು ಟೈಮ್ ಕೊಟ್ಟು ವರ್ಕೌಟ್ ಮಾಡಬೇಕು. ಇಫ್ ಯು ನಾಟ್ ವರ್ಕಿಂಗ್ ಔಟ್ ವೆರಿ ಪ್ರಾಪರ್ಲಿ, ಇಫ್ ಯು ಆರ್ ಕಮಿಟಿಂಗ್ ಎನಿ ಮಿಸ್ಟೇಕ್ಸ್ ಇನ್ ದಿಸ್, especially from this chapter, then this is a suicide. Okay, this is a suicide for you, because all students would be working out this one, and pretty most of the 80% of the students would be perfect in these things. Okay, if you are making mistakes, then you are under this 20% of the fools. Okay, so don't such mistakes. Okay, work out this everything. Okay, and these things can be asked for the reference based questions. ಜ್ಞಾನ ಬುದ್ಧಿ ಪ್ರದೀಪೇನ ಯೋನ ವಿಶಿತಿ ತತ್ವವಿತ್. ಸೊ ದಿಸ್ ಅಂತರಸ್ಯ ಆತುರಸ್ಯ ಅಂತರಾತ್ಮನಂ ನ ಸರೋಗಂ ಚಿಕಿತ್ಸತಿ. ಸೊ ದಿಸ್ ಶ್ಲೋಕ ಇಸ್ ಆಸ್ಟ್ ಇನ್ ದ ಎಕ್ಸಾಮ್ಸ್. ಇದು ಎಕ್ಸಾಮ್ಗೆ ತುಂಬ ಬಾರಿ ಕೇಳಿದ್ದಾರೆ. ಸೊ ದಿಸ್ ರೆಫರೆನ್ಸ್ ಬೇಸ್ಡ್ ಕ್ವಶನ್ಸಲ್ಲಿ ಆಸ್ ಎ ರೆಫರೆನ್ಸ್. ಓಕೆ, ಆಸ್ ಎ ರೆಫರೆನ್ಸ್ ದೇ ಹ್ಯಾವ್ ಆಸ್ಟ್ ದಿಸ್ ಕ್ವಶನ್, ದೇ ಹ್ಯಾವ್ ಆಸ್ಟ್ ದಿಸ್ ಶ್ಲೋಕ. ಆತುರಸ್ಯ ಅಂತರಾತ್ಮನಂ ನ ಸರೋಗಂ ಚಿಕಿತ್ಸತಿ ಜ್ಞಾನ ಬುದ್ಧಿ ಪ್ರದೀಪೇನ. ಓಕೆ, ಜ್ಞಾನ ಬುದ್ಧಿ ಪ್ರದೀಪೇನ. ಓಕೆ, ಆ್ಯಂಡ್ ನೆಕ್ಸ್ಟ್ ಇಸ್ ಆಲ್ಸೋ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್, ಕಾರ್ಯತತ್ವ ವಿಶೇಷಜ್ಞ. ಓಕೆ, ಸೊ knowing a very proper understanding of this karya tattva or chikitsa tattva. Okay, chikitsa phala or the falashruti. Okay, karya tattva visheshajna pratipatto na muhyati. So here the term pratipatti is used. So this is a very important term, pratipatti. Okay, pratipatti is making proper decisions or making proper decisions in the proper time. Okay, jititi kartavyata. Okay, so in the cases of the emergency, so how you are going to make the decisions. Pratipatto na muhyati. So he is going to make a proper diagnosis and he is going to implement the proper chikitsa. So this is a very important understanding. Okay, karatattva visheshajnah pratipatto na muhyati amudah phalamapnoti yad mohanimitajam. So this is important. And trividham jnana sangraham. So they have used this term sarvaroga visheshanam trividham jnana sangraham. Okay, trividha jnana. So how you will attend the jnana by using this trividha pramana. So this is a very classical understanding explained here in this chapter. Okay, so next we have Srota Vimana. In the next class we'll begin with the Srota Vimana. Okay, so you can just make a note of this Srota Vimana, and you can if possible we'll discuss in the evening class, because some rains are going on. So the network would be very unstable. So if possible we'll work out in the evening classes. Okay, so any doubts are there?